Did you know that your C-section scar could be affecting your pelvis and contributing to tightness in the backside of your pelvis and pelvic floor? Let's go ahead and explore a little bit on why that might be and how to address it. So if we think about with the C-section incision, you kind of think of it, I like thinking about it as kind of having plastic wrap around an area, then you've taken a hairdryer and everything is just kind of and pulled back in together with it. So we can think about how if everything is tight on the front here, that's going to pull my pelvis under in the backside and position all the backside hip musculature in a more shortened position. That's going to make it hard for them to lengthen and do the movements that we want it to do. So what we're going to work on is, instead of working it from the backside, we're going to teach the front side how to let go and lengthen to then bring the backside along for the ride. First thing you want to address is any restrictions in your C-section scar. No matter how old it is, it's important to assess this and progress can be made. We want to make sure that all layers work equally or move equally against each other, and that it moves well in all directions. If you need more help and guidance with that, it can be helpful to go to a pelvic floor therapist to instruct you on that a little bit more specifically, as well as get a little bit of extra hands-on, because it always helps to have someone else's hands that are trained to do that action get in there a little bit more. But it really is about consistency and just trying to chip away at it versus thinking that you're just going to do one bout of release work and then it's going to be better from there. After you've done that release work, you can think about trying to inhale into the bowls of your pelvis. This might feel nicest laying on your back or even on your side, so you can experiment with it. So as I lay on my side here, I can think about putting my hands on my lower abs and feeling my breath expand out with it. Now, we want to make sure that it's not all going out, but this equal kind of distribution of side to side, back, and then down into my hips. Inhaling there and then exhaling and relaxing. Do the same thing on the back where I'm here, hands on those lower abs, and thinking about inhaling, feeling them push out a little bit, exhaling and relax. You might even tip that pelvis forwards a little bit to give a little bit of length there and kind of rocking it back and forth even just in this position for it. But it could feel nice to be in that nice little stretch here. If you want to hang out here for a little bit longer and don't want to require any active work to be there, you can always add a small towel roll underneath that lumbar spine or top of sacrum to help give length to those lower abs and kind of breathe into that space. Then what we're going to do is go into a segmental cat cow. So with this one, we're going to have shoulders over wrists and hips over knees throughout the entire movement. Okay, so there's no shifting forwards or shifting back as you're doing it. You're going to start at your pelvis. You're going to think about those sit bones dropping down through the back side of the knees, lifting up through that spine, one segment at a time, broadening between the shoulder blades to get here. Now I'm going to flip it and go the other way. I'm going to lift that tailbone up, feeling those sit bones lift and separate, feeling my pelvis tip forwards and low back sink down. And then thinking it's like walking piano keys up my spine as I let the rest of it extend and shoulder blades slide towards each other. So it should be an equal kind of contribution to that extension. A lot of time what happens is if you're kind of restricted in those lower abs here or in the backside of the pelvis, we might have a hard time getting this action. So people might kind of get to this point and then they go all from higher up. So we really want to make sure that you're trying to encourage those rusty spots to do a little bit more. And sometimes just kind of, twerking back and forth can help bring improved awareness and lotion to the areas that are a little bit stickier with it. And when I go to tuck back under, I'm making sure that my abs are doing the work here and not my glutes as best as I can, okay? And again, we're looking for that equal curvature through the entire backside of your spine without shifting back or losing your neck there. After you've done some mobilization there, then it can be really nice to kind of work the abs and the breathing. So because the lower abs are tending to be in more of a shortened position, which can position the rectus muscles and those lower obliques into more of a shortened position, we're going to position them in a little bit more of a lengthened position or neutral. And then thinking about as we go to exhale, getting more TAs, where we're thinking about our hip bones pulling towards each other and compressing back without tucking. This can also be really helpful for working on the C-section shelf to make sure that the muscles are being able to eccentrically lengthen and concentrically contract to balance everything out. So we can do that in kind of a hands and knees breathing position here. So again, I'm making sure that I'm not just extended through here. I have that little lift. I'm making sure I'm not tucked here, but I have that little lift in my pelvis. So I'm in this neutral spine position. And then I'm going to inhale into my back, sides, hips, between sit bones. And then exhale, think hip bones pulled towards each other and back without tucking my pelvis anymore. You might have to think about keeping space between the sit bones there. Keep broad in between those shoulder blades. Inhale again. Exhale, wrapping it around towards each other. You can also watch for, if you have that lower belly pooch kind of above the C-section incision, does all your inhale want to go there? So how can you keep a little bit of tension there, but get the breath into the other areas instead? You can go into a rock back position to get a little bit more opening in the backside of that pelvis to help the breath go down and back instead of into those lower abs. So what that might look like here is I'm going to push the ground away, like I'm kind of pushing my hands on a treadmill. But because my hands aren't going to move and the floor is not going to move, that's going to help me sit back into my hips. You can even really challenge it by putting a yoga block on the back so that you know if you go to tuck, that yoga block will fall down, okay? We're also making sure we stay broad between the shoulder blades because we don't want to shift back and sink down. So it's that broad between shoulder blades, sit bones opening. We get back here, we can inhale into back between shoulder blades and sit bones. And then exhale, thinking of that nice TA contraction, keeping that bit of tension here, keeping that lift between shoulder blades. Inhale, and then exhale. If you need a little bit more help in that position, you could squeeze a block between your knees. That's going to kick in some adductors to help those hip bones pull towards each other and widen those sit bones. Conversely, you could also use a band that's pretty rigid or a strap to put around your knees and think about trying to push your feet and knees away from each other without them actually turning out. That's going to get some glute med to provide some extra pelvis stability that can also help open up the backs of the hips and pelvis. But hopefully after doing a little bit of this kind of isolated movement and freeing up, starting with some, passive hands-on type things, getting into this dynamic movement, getting some activation of lengthening and then contracting, and getting everything to kind of get on board and working together, it should feel like you can kind of stand with greater ease, and maybe your other movements like a hip hinge or squat feels better because you have improved control from your lower abs and have improved freedom of movement in your pelvis.